Hello everyone and welcome back. In this video, I'm going to talk to you about an issue I've talked about before, which is the fact that for a lot of people, quality, clinically appropriate treatment is simply not available. And I will put a link to this article in the description for the video. Mental health access is improving. Now let's talk about quality. I'm not sure I agree with this in terms of the mental health treatment being available. But I'm happy to talk to you about what I see here. Some of it is good stuff. Mental health care in the United States is at a critical moment. Nearly 1 in 4 adults experiences a mental health condition each year, yet many struggle to access care when they need it. As demand for behavioral health services continues to rise, the focus is shifting from whether access exists to how the care is being delivered and whether or not it leads to meaningful improvement. Access isn't just an operational concern. Across the behavioral health system, access to care remains uneven. Yeah, it does, especially for some of the most at-risk and underrepresented communities. While timely access is critical, it's only part of the equation. Historically, mental health care has lagged other areas of medicine in how quality and effectiveness are measured. When timely access to care is paired with outcomes-based measurement, behavioral health systems become more accountable and responsive. Patients connect to care sooner and gain clearer paths to improvement. So I'd like to hear from you. Have you had a problem accessing treatment, especially if you don't have health insurance or you don't have financial resources? And not everybody does. And look, I as someone who came to this country almost 40 years ago, I simply refuse to believe that quality treatment is not available to everybody. We have the resources here. We do. Why we're not using them, I don't know. I don't want to get on a political soapbox. That's not what this forum is for. But we got to do a better job. I know that Robert Kennedy has talked about putting more money into the behavioral health system. I like the idea. It sounds good. But, if you see what's going on in Minnesota and California and what went on during COVID, anytime the government throws money at a problem, there's always somebody out there who thinks it's an opportunity to get rich and that the money should go to them as opposed to people that really need it. So it sounds good. Whether or not it actually works, I don't know. I'm interested to hear your thoughts. Tell me what you think. Have you had a problem accessing quality treatment? Have you had a problem getting somebody into treatment? Have they been sucked into the Baker Act, right, Florida's mental health system, as a result because they went looking for help and then they got sucked into it? And I'm pretty vocal about the Baker Act too. If there's an issue going on in your family, please post in the comments. I'll make you a video if I haven't already, okay? Because if it's affecting your family, it's likely affecting somebody else's. And the least I can do is give you access to information. And by the way, if you call our office and you need a referral to a treatment center or a clinician or an interventionist, call. We'll gladly give you the names of some people, okay? You don't have to pay for this stuff. I'll give it to you. So please post in the comments. If you like this content, please give me a thumbs up. It helps with the algorithm. It helps us to get this content in front of more people, which is the goal here. If you like this channel, if you want more of this information, please subscribe to the channel. And we've just posted on the website. I wrote a brand new book all about the Marchman Act. If you download it, not only can you get the book, but each chapter has a video with me talking. And I'm even wearing a shirt and tie, right? As opposed to the baseball cap. So it's a different look at me. But the point is, this is just something else, some other way for us to give back. And I'll put a link to the book in the description for the video. And we're working on more content, more information about the work that we do so that you can get the information you need so you can decide if you are ready to take action. And with that said, thank you for tuning in. I'll see you in the next video. Bye-bye.